Thank you, everyone, for joining us today on our Ebola planning call. My name is Leslie Luke. I'm the Deputy Director here at the County of Los Angeles Office of Emergency Management. I'm going to go through a couple housekeeping issues, and then we'll go ahead and get started. This afternoon, you'll be hearing from the Superintendent, Superintendent Delgado. You'll also be hearing from Dr. Kim Farley from the County of Los Angeles, the PIO from the Department of Public Health, Sarah Garrett, and Frank Kwan from the County Office of Education. I'm giving you some pertinent information for you to take back with you. But in a sense of timing, I'm going to go ahead and turn it over to Superintendent Delgado to do some opening comments.
Thank you, and good afternoon to everyone. Thank you for joining us in the teleconference. Here, information about Ebola directly from our county's public health and emergency preparedness experts. That is an important and good opportunity for us to get a briefing on precautions regarding Ebola and the procedures schools need to follow in the event that the disease reaches our region. So we want to reassure schools in Los Angeles County that to date, there are no suspected or confirmed cases of Ebola in the county. We can also reassure them that the Ebola is not easily spread and even less likely to spread on a school campus. But in helping to keep our education communities healthy and safe involves a joint effort by all of our agencies, LA County Public Health, Office of Emergency Management, the Los Angeles County Office of Education, and the school districts. So we've had some productive discussions with Leslie Luke of the OEM and Sarah Garrett of Public Health. And so thank you, Sarah and Leslie, and Susan Chaidez from our Student Support Services, and Frank Kwan, our Director of Communications and Emergency Preparedness, for supporting our collaborative efforts. And as a school liaison for Los Angeles County Districts, we serve as the lead in the coordination of response efforts. We're the distribution point for protocols, information, and resources vetted by public health. So we have developed a health and safety page on our website as a central resource for schools, and we will continue to post updates on our resource page as they become available. So thank you for joining us for this 1-hour discussion on issues surrounding Ebola. And if we're not able to accommodate all your questions today, you can send them to communications@lacoe.edu. Again, communications@lacoe.edu, and we'll respond to you as soon as possible. Now, let me turn this over to Dr. Robert Kim Farley. He's the Director of the Communicable Disease Control and Prevention Division, Los Angeles County Department of Public Health. So, Dr. Kim Farley.
Thank you very much, Mr. Delgado. And dear colleagues, it's been a while since we all had a chance to chat with each other. I think many of you will remember our times with H1N1 not too many years ago. So I'm pleased to be able to have this opportunity to also be with you on this call to talk about now the issue of Ebola preparedness. I think, again, thanks to Mr. Delgado gave a brief overview of Ebola, the fact that it's not that easily transmitted. It really takes direct transmission. And worldwide, we're now at some 10,000 cases and 5,000 deaths. But I want to first reassure you, as Mr. Delgado just did, that there are no confirmed or suspected cases of Ebola in Los Angeles County. And I want today to be able to provide an update on our local work that we're doing to assure our schools as well as other residents that Los Angeles County is prepared to respond should a case happen here. We're trying to address any concerns that you might have relating to Ebola. And I wanted to, again, then make sure that you're aware that children have a lower chance of getting Ebola, mainly because they are less likely to care for an Ebola patient or come into contact with bodily fluids, as might be done, for example, for a healthcare worker that has returned from, let's say, Liberia after having cared for patients with Ebola. Public health departments, as you are well aware from the nightly news that you watch, across the country are now in a very aware, active mode. Again, we are trying to look at this issue of having a balance between making sure people are aware but not alarm. And I think that's important to realize that we're not in a mode of complacency, but it's not also business as usual either. So I think that we're trying to get a measured message out. We want to make sure, for example, in our healthcare system, that hospitals, when they are screening patients, are asking the questions about fever, other symptoms, and whether they've had a travel history to the Ebola-affected countries, which at this time is Liberia, Sierra Leone, and Guinea. So you can be assured that this is something that's taking a front and center position with the Department of Public Health, working in conjunction with the California Department of Public Health, our colleagues at the Centers for Disease Control and Prevention, to ensure that our hospitals are prepared to receive a patient, because you never can tell where such a patient might come in, and to make sure that we have certain selected hospitals that are prepared to actually treat a patient. So having said that, we're all working towards monitoring individuals. You probably know now that all flights with people from Liberia, Guinea, and Sierra Leone are being diverted into the 5 airports in the United States, and there is a screening questionnaire being done at that as well, at that port of entry, as well as monitoring for fever and other symptoms. If someone has had a travel history and is not symptomatic, they would travel here to Los Angeles if they were from this area, and would be given the name, and we would then be doing daily monitoring for such a person. They would be asked to self-monitor twice a day, and we would be in direct contact with them once a day. So at this stage, then, any student or staff member who was at an LA County school after traveling, even to a country with Ebola, would be cleared to attend by public health. You can be assured that if there was at any point and any concern, the public health would act, and act quickly to address the situation in an appropriate manner. I have very strong confidence in the procedures that we've developed in the department to keep our schools and our community safe. Again, though, the situation is fluid. Things can change over time, and we will be certain to make sure that you are aware of any changes in this. Our PIO, Sarah Garrett, will be talking about some of the frequently asked questions that we'll be putting onto our website, specifically addressed to the school community. I think you may find, and your parents and the children may find of interest. The efforts that we do for ensuring the safety of the people in Los Angeles County are continuing. We're working with hospitals, I mentioned earlier, healthcare providers, there to make sure that they are able to quickly identify and isolate any individuals suspected to actually have Ebola. Highly unlikely that any person infected with Ebola will ever be at a school. Therefore, there's no recommendation that school nurses wear any personal protective equipment. It's not recommended for any school officials to wear personal protective equipment. Instead, they should follow the standard infection control practices for other illnesses such as influenza. And influenza, for example, is also a disease that can be spread by, let's say, droplet infection, close proximity to a person, which is the same sorts of things that can happen with Ebola, but even Ebola is much more by direct contact. Speaking of influenza, I just want to take a moment to give a opportunity to put in a plug for making sure that students and your own staff have influenza vaccination, because as we know, influenza is a thing that can kill tens of thousands of people every year in the United States, over 200,000 hospitalizations every year in the United States, and so it is the real concern in terms of diseases of infection that we are worried about, and this one, of course, is something we worry about every year. So we have to make sure we're putting Ebola into a context of diseases that we know kill and hospitalize people. Now, school officials, we realize, see daily students that have complaints of fever, headache, vomiting, diarrhea, and this is going to increase, of course, with the flu season approaching. Again, we want to again emphasize that Ebola is not spread easily and is even less likely to spread in our communities. Lastly, it's very important to help manage our feelings and our students' feelings in an effective manner. Schools need to be sure they're talking about students' fears and explain that, again, that some of the things I've just mentioned earlier, that the risk of Ebola, of getting it, is very low. There are many plans in place to prevent the spread of Ebola. You have to recognize we're only talking about 3 countries out of the entire African continent and so most of the African continent is not affected by Ebola. We realize that ongoing coverage in the news about Ebola has caused concern for adults and children around the world, and it's normal then for them to feel some stress and anxiety during this time. We have to be trying to help manage their feelings and our feelings effectively. We've been collaborating closely with the Los Angeles County Department of Mental Health to identify things that we can all do to stay healthy, and also to recognize that travelers can help fight any fear with facts by turning to trusted sources of information. We also need to be careful not to leave out others who may have come from or have traveled to affected areas. Shaming people can create needless discrimination and can be emotionally harmful. We want to avoid stigma that may come with someone who've had travel. Again, getting sick and Ebola is very low risk in the United States. There's only been 2 people, and they are both healthcare workers that actually had any transmission of Ebola within the continental United States. The kids have a lower chance of getting Ebola since they're less likely to care for an Ebola patient or have come into contact with someone who had Ebola with their bodily fluids. Students or staff returning from travel should not be excluded from school. Again, I want to emphasize that students or staff that return from travel should not be excluded from school. Public Health has a county-wide task force. We're working very closely with our other departmental colleagues, including the Department of Health Services, the Office of Emergency Management, Department of Coroner's Office, DPSS, many others, Emergency Medical Services, and so more than 15 such county departments and agencies are involved with this effort of making sure, again, that we're doing what is prudent to prepare for any Ebola should it actually occur in Los Angeles County. We continue to enhance our readiness to ensure that we're all prepared, that we're better prepared today than we were yesterday, and we'll be better prepared tomorrow than we are today. So that in case a situation occurs where a case actually occurred in Los Angeles. We continue to partner also with cities and are in constant collaboration with, as I mentioned earlier, the CDC in Atlanta and our own California Department of Public Health. We continue to monitor closely and learn from events that are occurring elsewhere in the United States and around the world so that we can, again, continue to improve our preparedness and make sure our guidelines and documents and guidance is up to date and is appropriate to the situation. If you ever wanted to have general information or your parents or students wanted that, you can have them always dial 211. Operators are on call that have general information, can answer general questions. If you'd like information about mental health resources, they have a 24/7 access center number with their helpline, which is 800-854-7771. I'll repeat that. This is, again, mental health resources at their access center. It's 24/7, 800-854-7771. And you can also, for more information about what's happening at state level, contact the California Department of Public Health, and their public number is 916-558-1784. I repeat again, this is for the California Department of Public Health, 916-558-1784. And even at the federal level, again, you of course have the Centers for Disease Control and their hotline, which can be reached at 800-232-4636. I'll repeat that, 800-232-4636. And I might add that a very good resource is our own LA County Department of Public Health website, and again, at state level resources, the California Department of Public Health website, and the federal resources at the Centers for Disease Control and Prevention, CDC website. At this stage, I'm going to turn it over to Sarah Garrett, our Public Information Officer, for some of the resources that will be available to you in the outreach that is being done from her side. Sarah.
Thank you, Dr. Kim Farley, and good afternoon, everybody. Thank you for joining us on this call. So you may be getting a lot of questions from parents that might be calling your schools, and so we do want to encourage you to pass on that LA County information line number, which is 211. They can call that number and have general questions about Ebola answered. We do at the county are working on some materials that you can pass out as a school so that you can be more proactive and get some materials into the hands of your parents. So the situation like this, we do not have a case in Los Angeles County, but people are concerned. They want to know what action steps they can take. They want to know what the schools are doing. So we're preparing some resources for you as your school districts that you can hand out to parents. One of those items is a letter that basically goes over the current status of Ebola in Los Angeles County, which reiterates that there are no suspected or confirmed cases of this disease here in our county. It also reiterates that the risk of getting sick with Ebola is very low. It outlines what the basic symptoms are and how disease is spread. This is a letter intended to accompany our general frequently asked questions, which you can also pass out as a school. The letter will also outline that we do not recommend that students and staff who return from travel, even from a country that has been affected by Ebola, be excluded from school. And it explains the reasons why we don't recommend that we are monitoring those air passengers as they travel back into Los Angeles County if they've been away, and that they've been cleared to attend by public health, that we are working very closely with the schools through LACOE and through your school district to ensure that school campuses remain safe. We'll also go ahead and include links to the LA County Office of Education website, as well as the LA County Department of Public Health website in that letter, so that parents can go and check out information on their own. As Dr. Kim Farley mentioned, it is very important to fight fear with facts. There's a lot of anxiety out there because there are so many different news stories, and the news out of West Africa can be very alarming. So it is important to us that we frame the situation appropriately for Los Angeles County, and that you as schools can pass out this information on your own letterhead. So that letter will be available to you shortly, and LA County Office of Education will be assisting in making sure that you get a copy and you can send that out to your parents and staff on your own letterhead. The general frequently asked questions is from LA County Public Health. A copy of that is on LA County Office of Education's website. It's also on Public Health website. So we're really doubling up on our efforts to make sure that people do have appropriate sources of information, trusted sources of information that they could go to find out more about what's being done in Los Angeles County to protect everyone's health and what schools in particular are doing. In addition to the fact sheets that are available for the general public that would be appropriate for your parents, we do have a frequently asked questions supplement just for schools. On that, it explains that kids do have a lower chance of getting Ebola because they are less likely to care for a person who has been infected with Ebola. Again, this disease does not spread easily, and we want to emphasize that in all the materials that we send out. In addition, on that FAQ, we do say schools should focus on preventing more contagious diseases like flu and enterovirus. There's a lot of news right now about Ebola, but flu season is here, so we do encourage the schools to go back to their healthy hygiene messaging as much as possible and to emphasize that. It's a really good time to make sure you've got all those great flu prevention posters up, because we do not want cause for alarm for every cough, sneeze, and fever that may present as we head into the flu season. So we want to help manage that anxiety by emphasizing healthy hygiene, and hopefully you're going to have outstanding attendance this season from all your students, because everyone's going to be extremely healthy. So the numbers again for your staff to be able to give to parents if they want to call is that 211 number for Los Angeles County information, and then the numbers that Dr. Kim Farley mentioned at the state and federal level if they want to explore further what is happening at higher levels of government. We do want messages to be coordinated. Part of the reason why we are providing schools with a letter that they can issue on their own letterhead is that we want a unified message, that this is a county-wide preparedness. This is not individual. You're not on your own in having to prepare your campus and to let your staff know what you're doing. This is a county-wide level of preparedness and response, and so we want that messaging to be unified. I encourage you to contact our office if something does come up at your school and you need something that's more specific to your staff and to your students. Please call us. I'm going to give you our contact information. Our public affairs office can be reached at 213-240-8144, or you can email us at media@ph for public health .lacounty.gov. So those numbers again, that contact information again is 213-240-8144 or media@ph.lacounty.gov. I also encourage you to reach out to Frank Kwan and to Susan Chides at LA County Office of Education, and Frank will be providing that information when I turn this call over to him in a minute. but please do coordinate your messages with our department and with LACOE. Again, we want that broad level, county-wide, unified messaging to let everybody know that there are multiple steps and a multi-layered approach to ensuring everybody's health and safety. The last thing that I do want to encourage you is, just like we promote staying healthy during flu season and staying healthy with many other diseases that can occur, many other illnesses that can occur on a school campus, such as norovirus and all the various aches and sniffles and sneezes, we do also want to emphasize mental health. So we do have mental health frequently asked questions and other tips about ways that you can talk to students, or ways that staff and teachers can talk to their students about some of the anxiety that students may have. We also recognize that on school campuses, it can be very easy for children to just react and want to stigmatize other students. And so we want to discourage that, and we want to encourage more welcoming and more socially inclusive behavior. So that information is also available on our website. To get to our website, please go visit www.publichealth.lacounty.gov, and all of our materials are available there. Again, that's publichealth.lacounty.gov, and then Frank is now going to talk about LA County Office of Education, and he can give you his contact information there.
Thank you, Sarah. We've got to do this before with different types of things, actually working very closely with public health. The advantage, of course, in working with public health and also the Office of Emergency Management is that they are credible sources within the county. That's a critical type of thing, simply because there's so much information that's out. It's easy to get distracted by a lot of different kind of sources. So primarily, the site that we have on our own website, that's www.lacoe.edu. It's right on the home page. There is the ever recognizable Ebola virus type of thing right there. Just click on that. And it'll take you directly to our health and safety page. That is still a page in development. Obviously, we're at the beginning stages, but we will be putting a great deal of information on there in terms of resources, materials, the FAQ, links, all the phone numbers that you've heard kind of go back and forth, as well as the web addresses will be all on there. There will also be other resources, such as a recording of this particular call. So we will have those on that particular page, and you'll be able to stream that later on. And one of the other things, of course, is that this is from Dr. Delgado at LACOE to our superintendents, is that we have consistently been sending out advisories. We will continue to do that, particularly as the situation changes and develops. Because I think this is, as Dr. Kim Farley pointed out, it's a very fluid situation, and that we are going to continue to monitor it and work closely with public health to make sure that we provide the updates as they occur, and that, again, these are sources that come out of public health, and therefore, we have a strong belief that this is the best way to address this. There is a lot of information that is available, and our job working with public health and OEM is to make sure that the information that the schools get is actually there. The other piece of that, of course, is that as your questions develop, as Dr. Delgado mentioned, if you just send it to our email, communications@lacoe.edu, and we'll gather up those questions. If they're appropriate for public health, we'll send it over here, or to OEM, or wherever they need to go. We'll try to address those. But again, this is a developing piece, and I want to thank public health and OEM for responding so quickly in terms of setting up this call. I think it's very much needed. We heard directly from superintendents that expressed a number of concerns and said, what are we doing? So this is a way in which we can address that. And with that, I'll turn it back to
Thank you, Frank. Gregory, I guess we can open it up for any questions. We're probably in a position to do that now.
Thank you, Mr. Luke. And ladies and gentlemen, if you'd like to ask a question, please press star then 1 on your touch-tone phone. You'll hear a tone indicating you have been placed in queue, and you may remove yourself from queue at any time by pressing the pound key. If you're using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you have a question over the phone lines, please press star then 1 at this time. And just a moment, please, for our first question. And we first turn to the line of Joe Mitchell. Please go ahead. Your line is open.
Hi, thanks for taking the call so quickly. I just want to confirm, because we do have a provider program that is taking care of a student outside of our district who does have a nurse who's returning from Cameroon in about a week or so. seeing a sick sister. So I just want to confirm that if she comes back from Cameroon, there's nothing I need to tell our neighboring district who's taking care of our child that they have to do in terms of a protocol for this nurse to come back and work with this child. Is that correct?
Thank you, Mr. Mitchell, for that question. You are exactly correct. If the person is coming from Cameroon, that's not one of the Ebola-affected countries, and there would be no need for alarm or concern.
Okay, thank you very much. Appreciate it.
And again, if you'd like to ask a question, please press star, then 1. Next, we turn to the line of Ryan Foran. Please go ahead. Your line is open.
Yeah, I'm just checking when the letter will be ready to go and when will that be sent out.
Hi there, Ryan. This is Sarah Garrett from Public Health. We are working on finalizing that letter by end of day today, and we are working with LACOE to get it out tomorrow.
And we'll also have it posted on that particular web page as well. So we're distributed, and it'll be on that web page for whenever you need it.
It'll also be available in both English and Spanish.
And our next questioner comes from the line of Laura Morn. If you would please state your question and your district.
Santa Monica, Malibu Unified School District, Laura Morn. We had a student enroll about 2 weeks ago from Guinea, and I think our confusion was that we didn't know what the student's guardian had been told as far as taking the temperature, and whether they, one, had a thermometer, knew how to read a thermometer, and knew exactly what a temperature was, and also that the student was not connected with a physician. So that was some of our concerns.
Well, at this stage, if we have any name of a person that has had recent travel to one of the 3 countries, again, be interested in that name. But we have been, again, following up with all passengers. So at this stage, that's what our procedures are.
Okay, so you're saying if they did arrive 2-3 weeks ago, they were actually being followed. Any student or any people who came, the student lived there, was new to the country.
This is Dr. Schwartz. I work with Dr. Kim Farley at the Department of Public Health. The CDC just began informing us of travelers coming from the outbreak countries about a week and a half ago. And so if this person came from Guinea before that, we would not necessarily have been informed. However, the important thing is to recognize that the risk associated with this child or any child coming from the outbreak area is very low, and we will continue to be monitoring travelers who come in and making sure that they are not infected. If you wanted to share with us after this call the student's name, we would be happy to follow up with you or with the family to make sure that that there is no risk of disease currently.
Yeah, we did go ahead and call the guardian and just double check to make sure that they were given the information and knew how to read a thermometer, and that the nurse's office was available, who the student, what the student looked like in case the student became ill during the school hours. We also had a situation where a student in one of his classes started to refuse to attend class because she knew where he had come from. But we did handle it at this point. I think, we know that the guardian is doing what they're supposed to do, but we didn't have a lot of direction at that moment.
Yeah, one of the things that we'd like to do is to provide to you our acute communicable disease program's number, so that if there are any questions, any situations where there is a student or a family who you're concerned about, you would be able to call us, and then we can add them to the list of people who we are following who have arrived from one of the outbreak countries. And the number for our acute communicable disease control program is 213-240-7941. Again, 213-240-7941.
And it needs to be for professionals like yourself It's not the public number.
Correct.
Yeah, thank you.
Yeah, I did contact our public health nurse that works with us, and we chatted about the best way to handle it, and that's what we came up with. So I think we're okay at this point, but yeah, it's nice having a little direction, so I appreciate this call.
Well, thank you. We really appreciate the partnership and collaboration. I think that we need to do is be really joined at the hip, so to speak, on any of these situations. We want to, be working together closely.
Yep.
Next, we turn to the line of Dr. Amy Enomoto Perez. Please go ahead.
Hello, can you hear me?
Yes, we can.
Good afternoon. Our question is, will the letter be available in Vietnamese and Chinese?
Hi, this is Sarah from Public Health. We are working on other translations. The letter will initially be available in English and Spanish, and then we'll get those additional translations as quickly as we can, hopefully by the end of the week.
Thank you.
And those alternate translations will be posted on LACOE's website. And if anybody else has any specific languages that they would need the letter translated in, we do work on our materials in the 11 threshold languages for Los Angeles County, of which Vietnamese and Chinese are English and Spanish are 4 of those 11 languages. But if there's anything specific, please let us know, and we will try and see if we can accommodate that.
And we have a follow-up from the line of Ryan Foran. Please go ahead. Your line is open.
Yeah, Ryan again from Arcadia Unified School District. I'm just wondering if you want all the districts to send out the letter kind of immediately, go by each district's discretion. I kind of put out a feeler with some other PIOs about whether they've communicated any Ebola kind of communications with parents and stuff, and a couple have, most have not yet. So just kind of curious your thoughts on the communication aspect as of now.
I think from my perspective as a PIO for public health, I would prefer that the school districts start to push this letter out this week at your discretion. Pick which day works the best for you guys. Again, if you do need it in those alternate languages, then you may need to wait until, or you may choose to wait until the letter is available in all languages for your school district. I think the golden rule should be as soon as possible to get that information into those parents' hands. Right now, there are no confirmed or suspected cases of Ebola in Los Angeles County. We are monitoring. However, that situation may change, but it is still important for parents, students, and staff members on school campuses to remember and keep in mind that the risk of getting Ebola just through casual contact is very, very low. So we do want those materials in people's hands sooner rather than later.
Brian,
Okay.
Brian, this is Frank. I might suggest, though, that given your district, you might want to wait if you intend to send this out in Chinese, which I think you might, then you might want to wait to send it out till you have them all available at the same time. Because if some people get it and some people don't, you're probably going to hear about it not necessarily in a good way. So I would recommend waiting until you need to send it to all of the people, all of the parents in the district.
Yeah. We were just having a discussion last week about, kind of educating the public or kind of maybe possibly instilling fear if we start sending stuff out on it. But I think, with all the media coverage, it's probably getting to that point where just settle the fears and educate the public as what's going on in our area.
Right. And again, the letter is designed to provide that unified messaging. And when you do look at the letter and you feel that for your school district it would be prudent to add a couple of sentences specific to your school district to, again, help manage the anxiety or fear-based messaging that might be out there, or fear-based news stories that might be out there, then that's appropriate. My most important goal is to just get language to you guys that kind of reflects this overall county preparedness, both from us at Public Health and LA County Office of Education and LA County Office of Emergency Management.
Great. Thank you. Appreciate the help.
While we're waiting, Greg, I'll allow Frank and Sarah to again give out those websites so everyone has an opportunity to make sure they know where they can find this other information.
The website address for the County Office of Education is www.lacoe.edu. LACOE.edu.
And for Public Health, it's www.publichealth.lacounty.gov. If you look on our homepage, there's a button that says Ebola. You just click on that, and it'll take you to information in English and in Spanish. And again, as we get those additional languages available, they will be on our website.
We'll probably send out an advisory in the next day or so then that has the website address just in case. And those go out to the superintendent as well as the operational folks at the districts, and we'll look at Susan Chida's and,
And we have a question from the line of Sandra Wignott. Please go ahead. Your line is open.
I'm wondering whether or not if by sending out a letter to the parents preemptively, if it might cause more concern than allay concerns.
Oh, I'm sorry. Sandra, what school district are you with, by the way?
I'm with Birmingham Community Charter School, which is loosely affiliated with the LAUSD.
So the idea behind the letter is to give, again, schools the ability to start to have that conversation with parents, to let them know that they are working with the County Office of Education, that they're working, in your case, with LAUSD, that they are working with the Department of Public Health, so that the school is not unaware of the situation, and there is that balance between aware and alarm that Dr. Kim Farley was mentioning. So we are planning these messages that can be handed out to parents so that they know the school does have a plan in place, that there are plans in place at the county-wide level to ensure your child's safety and staff safety on a school campus. So I do recognize that there may be some concern where parents may not have paid much attention to the issue. Suddenly they're getting a letter and a fact sheet about something that they haven't previously paid much attention to. But as somebody mentioned earlier, I think that the news stories at this point have reached a level where they may have questions as to what your school campus is doing. And I think that having this tool available to your school would be helpful in making sure that you can have a message to give to your parents.
Okay. All right. Thank you.
And next we turn to the line of Foy Fan. If you would please state your district and your question.
Hello?
Go ahead.
Okay. This is Tweed from Bellflower School District. I'd like some clarification as to signs and symptoms. I understand Ebola signs and symptoms. One of the signs and symptoms is vomiting. So I just want a clarification on what is the likelihood of transmitting the Ebola virus through vomit or saliva or mucus with an Ebola symptomatic person when they cough or sneeze?
Yes, I think a couple of things to recognize again is that people who have symptoms for Ebola will also have the fever. So if you're very unusual to think about having someone who would have Ebola without having fever associated with those other symptoms. Again, they have to have the travel history as well. So it's a very, very narrow subset of folks. But in answer to your question, from a technical point of view, that yes, if a person had Ebola, was symptomatic with Ebola, the vomit or diarrhea would be a contagious fluid, a bodily fluid.
But is that a real concern as far as if they're already symptomatic, if they're already confirmed with Ebola and they're coughing or sneezing? Is there enough concentration in the saliva or the mucus or the vomit to be of concern of transmitting the Ebola virus?
Yes. Now, again, to recognize a few things is that Ebola, obviously, we've talked in the past, that it's not contagious before someone is symptomatic. When someone is initially symptomatic, it also actually is not that contagious. They get continually more and more contagious as time goes on. In fact, when we do our Ebola testing with the laboratory, if we test an immediate onset of symptoms, that even may be negative because the virus load in the body is very, very low. We have to retest again in 72 hours. And progressively, as a person worsens in their condition, the virus load becomes higher and higher. In other words, the vomit, the diarrhea becomes higher in concentration of virus particles until in the worst, highest situation is when a person is dead. A dead body is extremely contagious. Dr. Schwartz, did you want to add anything to that?
Well, one thing I would add is just the reminder that Ebola is not spread through the airborne route. It's spread by contact with respiratory droplets, with vomit, with diarrhea, or other secretions. Therefore, according to the CDC, if one is more than 3 feet away from a person with Ebola, transmission by saliva, by sneezing, by coughing will not occur.
Okay. Thank you very much.
Welcome.
And next we turn to the line of Gail Nelson. Please go ahead.
We have a question. What do we do if we have someone who, joking or not, comes into our schools and says they have Ebola? How do we handle a situation such as that?
I think, again, there's going to be a potential for hoaxes of people trying to do this. I think a situation like that, are we talking about a student, in a classroom saying this? Are you talking about a stranger rushing off the street and yelling out, "I got Ebola," and then rushing back to the street? I mean, I guess it depends on what the situation is.
The students.
Yeah, well, I think, again, that student would be taken aside and talked about, what makes you think that, and, is there travel history here involved, which, again, is going to be very hard to imagine with the amount of screening that's going on. And, again, when it's discovered, as it's most likely going to be 99.99% of the case, a hoax, to be able to counsel that student about these are serious matters. It's not something to be laughing at. It's just the same thing like yelling fire in a crowded theater and things like this. It's something that probably requires some disciplinary action.
Thank you.
And speakers, we have no further questions in queue.
Thank you, Gregory. I'll turn it over to the superintendent for any closing comments he may have.
Dr. Delgado may have it on me.
Okay.
But, I think he is, his goal and desire is to make sure that school districts have all of the resources necessary, as much as is available to them, to support their efforts in terms of working with their school populations, their local communities and parents, that we support the work of public health and the Office of Emergency Management in terms of being able to provide the resources as well as the information. So we will continue to communicate regularly and frequently with the schools on this issue until we get to the next stage of this. Thank you.
And again, on behalf of the Department of Public Health, we are very pleased to have had this opportunity to chat and discuss this with you. You can be assured if the situation ever changes, that we'll be back in touch with you. And again, through your own contacts with LACOE, we're always happy to answer any questions and be available to you.
Thank you, Gregory, and thank you, everyone, for calling in today. If you have any other questions, I think the County Office of Ed gave you an email address to forward those other questions to them, and they will make sure that they get to the proper person to be able to answer that for you. So thank you for your call.
And ladies and gentlemen, that does conclude our conference for today. Thank you for your participation and for using AT&T Executive Teleconference Service. You may now disconnect.